Our prescription monitoring program is the Controlled Substance Reporting System, the CSRS, and it's been in place since about 2007, collecting data since around that time, and really more completely collecting data since 2008. So it's a relatively new system, and it's a huge system. I mean, this is a system that annually receives about 17 million controlled substance prescriptions a year. And so we're trying to obviously tease out a lot of different things from that. And I think early on, there were clear benefits. There was a criteria and definition set to identify some folks who really exceeded kind of natural limits and unusual patterns, and those folks were kind of tossed over to the criminal side for further investigation. And the primary function of the CSRS, though, is to be a clinical tool and a public health surveillance tool. So its intent is really to work for providers and prescribers and dispensers and give them an opportunity to evaluate a patient's history. And so when someone comes into an office somewhere, hopefully one of the first things the provider and their staff are doing is looking at that record to see if there are any things any conversations that they need to have. Sometimes it might be as simple as, hey, I noted that you're also getting some other medications from another provider. We need to really understand kind of the interactions between these medications, and I'm not sure if they're reviewing this. Hopefully they are, but I need to work with that other provider to make sure that we're on the same page in terms of your overall treatment. I think sometimes patients, innocently don't think of the kind of holistic aspect of their treatment. If they're seeing someone for back pain, they're seeing someone for back pain, and if they get a medicine for back pain, they get a medicine for back pain. Now, if they're seeing another provider for anxiety issues, they're seeing that doctor for anxiety issues, and they're not necessarily thinking the medication that this person gives me and the medication that this person can give me could necessarily kill me. And so, again, it's hopefully a benefit for both the patients and the providers, but North Carolina has really tried to make it a clinical tool and clinically beneficial. I think where we've seen it on the surveillance side that's been really useful is that when we took those 1,000 people who died from prescription or medication drugs, we tried to then look at their histories of prescriptions, controlled substance prescriptions in particular. And I think that's when we started noticing some interesting patterns. I think there's this notion that there's just a ton of, for the people who die, there's a ton of misuse and diversion and things that are illegal activity in part. And I think when we started to look at some of these linkages, I think we started to see a much more consistent pattern of a lot of the things that people were getting were being prescribed to them, and in relatively reasonable amounts. But maybe there were combinations of providers that they didn't see, or maybe there was kind of an increase in dosage that others might worry about or be concerned about, and it was just putting patient safety and patients at risk. We're far from being the model of the CSRS. I mean, our system still has plenty of ways it can improve, and there were actually legislative changes to hopefully help improve that system, including things like delegate accounts, reducing the reporting time from a week to 3 days or less if possible. There were some variables that were added to the system, including payment source, which could serve as a proxy indicator of potential diversion or misuse. So that law went into effect in 2013. Most of those, some of those, the changes have already happened. Some of them haven't really happened to date, or haven't been as effective as they should be to date. So it's still a work in progress. And so, in terms of other states and utilization, there's some states who have done some really creative things in terms of the surveillance capabilities of their PMP. We're starting to get there. We've seen increases in terms of utilization from providers and dispensers. The number of people who are registering to use has increased, significantly since some of these laws have passed. We're still in the midst of trying to provide educational background for its existence. I mean, it's not uncommon to show up at a meeting of people who are prescribers of controlled substances and say, how many people are using the system? Raise your hand, and only half of them do or less. So we really need to make sure that everyone understands the system, everyone understands the benefits of the system, and that those benefits truly result in changes in prescribing behavior so that patient safety it's a better patient outcome.